How effective is the seasonal flu vaccine? How effective is the seasonal flu vaccine? This is a question many people ask, especially during flu season. The effectiveness of the seasonal flu vaccine can vary each year, typically ranging from about 40% to 60% in preventing influenza illness. This variation largely depends on how well the vaccine strains match the circulating flu viruses during that season. Even when effectiveness is on the lower end, vaccination still provides important protection against severe outcomes such as hospitalization, intensive care admission, and death. The flu vaccine generally targets multiple flu strains. It includes 2 influenza A strains, H1N1 and H3N2, and 1 influenza B strain. Each year, health authorities adjust the vaccine based on global surveillance data to best match the expected circulating viruses. For the 2020 0 to 5 season, trivalent vaccines were used, covering 3 strains, with the influenza B Yamagata strain removed due to its absence in circulation. Recent studies and surveillance data show that vaccine effectiveness estimates for the 2020 0 to 5 season ranged around 40% to 60% for preventing medically attended flu illness. Effectiveness can vary by age group and virus subtype. Vaccination has been shown to reduce the risk of severe flu outcomes. For example, adults who were vaccinated had a 26% lower risk of intensive care unit admission and a 31% lower risk of flu-related death compared to those who were unvaccinated. Additionally, flu vaccination is linked to lower hospitalization rates in individuals with chronic conditions like lung disease, diabetes, and heart disease. However, some recent studies that have not yet been peer-reviewed reported unusual findings. One study observed a higher incidence of flu infection among vaccinated adults during the 2020 0 to 5 season, resulting in a negative calculated vaccine effectiveness. It is important to note that these findings are preliminary and should not guide clinical practice. Established public health authorities continue to recommend flu vaccination as the best available method to prevent influenza and its complications. Several limitations can affect vaccine effectiveness. These include mismatches between vaccine strains and circulating viruses due to virus evolution, variability in individual immune responses, and differences in vaccination status classification. Incomplete vaccination, such as children needing 2 doses, can also play a role. Other factors, like prior infections or underlying health conditions, can further complicate effectiveness. In summary, the seasonal flu vaccine remains a key tool in reducing influenza illness and its serious complications. While its effectiveness can fluctuate yearly, it consistently provides meaningful protection, especially against severe disease. This supports the recommendation that all persons aged 6 months and older receive annual vaccination during flu season. Always consult with a healthcare professional for personalized medical advice regarding vaccination.